Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
I guess I kind of aggravated an old injury driving to work. And I guess I made it worse. Just continue to work on it.
How long has this been going on?
For a few days now.
Okay.
It was really bad a few days ago. It's gotten slightly better.
How much pain do you feel there from 0 to 10? 10 is emergency room.
It was a 10 at some point.
Okay.
And
so
now it's like at a 6, 7.
6, 7.
Yeah.
Where do you feel the pain? Would you show me?
In my wrist, right here.
Okay.
Right here on the inside and outside of my wrist.
What would you show me your range of motion? What's difficult for you to do?
So I'm getting a little bit of tightness trying to grip and also extend my wrist back as well as go forward.
So it's look like it's very tight here.
Yeah. So this is pretty much as far as I can go.
You're not really flexing much. Yeah. So how many days that was?
So it got really bad Wednesday, Thursday.
Wednesday, we are on Monday now, so it's almost like 5 days or something like that,
so
4 or 5.
It's pretty tight.
Have you had any treatment before coming here?
Just a small consultation with the chiropractor.
Okay.
Other than that,
did he do anything?
He's used the metal knife to break down some
Graston,
Yeah. But other than that, he just gave me a few home exercises. Other than that, no other treatment.
So how much pain you feel right now?
If I rested like this, it's okay. Thursday and Friday, I was in agonizing pain, but I didn't want to go to the doctor.
So if we aggravate your symptoms now, how much is it gonna be? Just do the range of motion that aggravated, and because we're gonna use that for testing now after the treatment. So extend and flex and tell me how much pain.
Right. I mean, it's tolerable right now. Keeping it that way, it's
just flexing this way,
testing purposes, I can manage it.
Bring it this way, and flex and extend. Yeah, you're very tight, very slow, actually very stiff, and you can see a little bit swelling here. Your range of motion is very limited. We're gonna work on that. Okay, how much pain with that?
Maybe like a 6 or 7.
Okay, so relax. So full extension, let's bring it back up and stop when you feel pain.
Okay, it's tight there.
It's tight. Yeah. So you can see like it's a 50. Well, 1 second, here you go. It's a 55 here. This is 55. Extension 55. Remember these numbers, okay? Flexion.
Alright, that's okay.
How much pain with that?
That's okay.
That's a 35. 35. Sorry. How much? Okay. How much pain with that? This is like 6. Okay. The other way.
Alright.
Okay. And that's like. Turn it over. Your symptom. You feel this knot here? You feel that? And you can see it in my hand. You see it's my hand is just. You see? Sorry, is that
no, it's
okay? You see that? That's a big knot inside here. So with this instrument, Graston, you will never be able to get to this. It's very deep inside. That's not gonna get there. Is it too much?
Earlier it was a little bad, but now it's bearable.
Okay. Sure, it's not too much, okay? Yeah, I didn't need to mention that. Oh. You will see the scar tissue where you have redness here, but
Mhm.
make sure it's not painful, okay?
Yeah.
So you said you have pain here too?
Yeah.
Because I feel a lot in this area. Sorry, is that too much?
A little bit.
Okay.
There's nothing as bad as
Saturday?
with the chiropractor.
Yeah, Graston is more, it's painful, yeah?
Yeah.
Yeah, I don't agree with this philosophy from 0 to 10. You're moving faster now.
Yeah.
You see the speed? That's beautiful.
Yeah, before I used to be very gingerly about all my
Yeah, it was like a gear.
Yeah.
It
was grinding. It was grinding.
Yeah. It was like
Now it's
stick,
like okay.
it was like a stick shift. How's that? Any tightness?
A little bit, but it's much
Where?
better. Like I was.
How much and where?
But it's smaller. It's like maybe like a 3.
Where?
Like right here.
Okay.
Seems like every time you fix one spot, the smaller spot keeps showing up. But
Yeah. Well, we're moving on.
Yeah.
Because you start to compare tight to loose.
Exactly.
Loose. So that's a good sign. We're moving on. It's not we're stuck in one area.
Exactly.
Yeah.
So,
But that shows that you have a lot of mess here.
no, it's probably been years and years of like
Years.
just neglect.
A lot of
Yeah.
driving, yeah. So let me get this thing. Okay. Let's do it again and tell me how's the tightness. Extend. How's that? Flex. How's that? You still feel it or it's gone?
Oh wow. Before
You're
I
making
can.
fists. You could not make a fist.
No.
You were like sitting
Yeah, I
like
was
this.
just like this, but before
Yeah.
now it's like I can actually apply some pressure.
Yeah, that's cool. Any tightness?
Slight, but it's not something that is unbearable.
It's
You know,
probably
it's just-
from the swelling
Yeah,
there. As
yeah.
long as you don't
More
feel
than anything else, it's probably from the swelling.
As long as you don't feel pain, that's fine because I
It's just
expect you're
tightness,
gonna
it's not
have a
pain.
little bit tightness from the swelling until we get the swelling down. Okay, extension. How much was originally?
55.
55. Now is. Look at this. 75. We're maintaining that range of motion. 75. Okay. Flexion. How much it was?
35.
35 originally. And let's see. Just lower this down. 35, and now we are 60, almost 60, 63, 63. Okay, ulnar, radial,
Radial 6.
6, and now see how far we can go with this. What's that? That's 20, 22. That's 22. You see that? 22.
Yeah.
Yeah. Okay, let's do the other side. How much is the radial? Oh, the ulnar. This is on 20. Now is 30, 32. Here. So move your hands and tell me how they feel. What do you think about the ASTR treatment? Just working for a few minutes.
Yeah.
So can you tell the difference between Graston and ASTR, because you had Graston 2 days ago?
Yeah.
Can you tell any difference?
Oh no, this is much gentler.
Yeah.
Over there, I kind of felt like a slab of meat, but this one's more.
Yeah, so it was painful. Graston was painful, and this is not painful. What about the range of motion?
It's a lot of progress for only.
Yeah, did you get any progress with Graston when they moved worked on it?
I think a lot of home therapy might have helped, but the Graston is pretty painful. But this is something that I'd much rather prefer than doing Graston.
That's awesome. Yeah, thank you so much.
Oh, I appreciate it. No,
yeah, any pain, discomfort?
No, just tightness, but not really pain.
Tightness from the swelling. We can work on it.
Yeah, walking in, it was pain.
Look at you. You're moving your hands now. Yeah.
Oh no, this is a significant difference.
Yeah, that's beautiful. Look at that. Yeah, awesome.
Yeah.
Thank you so much.
Thank you. I appreciate it.
Yeah.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.